neuromuscular blockers.
Okay.
These are also neuromuscular blockers. Then we start running into some of our cardiac medications. We've got some atropine, esmolol. These are all, atropine is an anticholinergic. It's to increase your heart rate. These will decrease your heart rate. This one is more beta-1 specific, esmolol. This is labetalol, and it's an alpha and beta. It's mostly beta. This is neostigmine and robenol, or glycopyrrolate. These are what are called reversal agents. So after we use these neuromuscular blockers, the non-depolarizing neuromuscular blockers, we can actually reverse their paralytic effect by administering the neostigmine and the glycopyrrolate. The glycopyrrolate is given with the neostigmine to counteract some of the cholinergic effects that the neostigmine may cause. This is lidocaine. Can be used, as local anesthesia. It can be used it could be used IV to decrease the burning from the propofol. It has several uses. It could be used for IV administration for VTAC or ventricular activity. This is Reglan, and it's to increase gastric motility. This is some antibiotic, some nasal spray if you do nasal surgeries to constrict the blood vessels so you decrease bleeding. This is some albuterol. If there's any increase in bronchoconstriction, you could administer that. There's some emergency drugs here.
Is that asthma, like asthma medicine?
Correct, yep, like asthma. It's a bronchodilator. This is ephedrine. It's a blood pressure medicine to help bring blood pressure up. This is phenylephrine, also helps to bring blood pressure up. This one works on beta receptors directly and indirectly. This one works on alpha receptors directly, which just squeezes. This is epinephrine, very important drug. It can be used for lots of things, but it's a ACLS medication, cardiac resuscitation medication. There's some metoprolol, another beta blocker. This is some Benadryl. Can be used. Also has several uses. It can be used now prophylactically as antiemetic, but also for its H2 properties. Furosemide is a diuretic. This is naloxone, and this actually will reverse if patients receive too much narcotic. It'll actually antagonize the narcotic, which means to reverse the narcotic. So we rarely use this.
That's for like people that's on drugs and stuff?
No, it's say here, I felt that she required more narcotics during the case. At the end of the case, the patient hasn't come back spontaneously breathing, and it's been a long period of time. All other issues have been resolved and checked. Patient's been reversed. You evaluated everything else and done your differential diagnosis. If you feel that the patient had too much narcotic, then this is it's to rescue someone from respiratory depression. This is heparin, and it's a blood thinner. It's used a lot of times for vascular surgeries. There's some calcium chloride in here, which is another emergency drug. There's some lidocaine here, which we would generally use in an emergency situation. This is amidate, and this is an induction drug. This is another one of those medications that will induce sleep. One of the good things with this medication, if a patient has some hemodynamic instability, this is a lot more hemodynamically stable than, say, propofol.